Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hi, my name's Michelle Hardy, and today I just want to share with you a few little bits of information that I really feel that if you are considering NHS conversion, these are the pieces of information that you need to know and have nailed before you can make your decision. So one of the first and the main things you're going to want to know is how many patients are you going to need to replace your NHS income? Now, obviously, because the contract for the NHS covers both diagnostic and prevention, and it also covers treatments, we're not trying to ever replace all of it with a plan. What we're trying to replace is the diagnostic part of the appointments, for example, examinations, hygiene appointments and x-rays, and obviously the money then for the treatments will come over the counter as and when the patients attend. So we will normally run an income replacement calculator that works out how many patients do you need to replace the percentage of your contract. The other thing obviously is going to be key is knowing how much you're going to need to charge, both for your plan memberships and also for your private treatments. And what we do need to consider in here as well is how much of your private income that you already earn comes from NHS patients. Because generally speaking, with a conversion, you're going to be looking to reduce your patient numbers quite significantly. So if there's a lot of private income invested in those patients, then we do need to take that into consideration when we're doing the calculations to look at the income that you're going to need. So again, this is something we can help you with as part of all of that overall income replacement that we would do with you. Another important thing to consider is, have you had any discussions prior to going ahead, both with your associates and with your staff, to ask them, are they comfortable? What are their views on what are you thinking of doing? Are they on board? And to be really sure that have you got the right team on board and in the right places for when you decide to press that button and go ahead? Because certainly your front desk team are going to be absolutely crucial. You want the best team members on there that are going to be able to have reasonable conversations with the patient and that are going to be comfortable with that, and they're going to be comfortable with the challenges that arise from that. But also, if the conversion is going to be for a full practice, we need to make sure that all of your clinicians are also on board. We've addressed any issues that they might have or fears they might have prior to them going ahead with that. So the earlier that you can involve your team in those discussions, then that's absolutely the best way to go. Something else to consider is, what is the NHS availability both locally and going to be in your practice? So is there going to be NHS, or are you thinking of giving the contract back for the whole practice? If you are, what's the criteria? How much of the contract do you perhaps want to keep? And do you have the right amount of clinicians to be able to pick up any UDAs for any dentists that are converting? So this is quite a big question in itself, really. So just looking in terms of your own practice, if you're giving the contract back, obviously we will look at the figures for the whole practice. There is no NHS availability anymore. It's quite clear cut and straightforward. But like I said earlier, if you are thinking of a partial conversion where it may be just one dentist or a couple of dentists in the practice that are going to convert, then we do need to address what is your policy going to be during that conversion in terms of taking on new NHS patients and how that may affect you. Because obviously, if you've got an open NHS list, then in terms of uptake, when you decide to convert, the uptake is going to be much lower. And again, we need to factor that in. It's also worth knowing what's happening in your local area with other practices around you. Have any of them got open lists and are actively taking on NHS patients that may well impact on your conversion results? So we do need to know both your own practice and externally what that looks like. In terms of converting, obviously it might be a full practice conversion, or you might be considering a partial conversion where maybe just you as a principal dentist might be deciding to go private, but you're wanting to keep the UDAs within the practice. Now, if that's going to happen, then what you need to establish is, first of all, have the other clinicians in the practice got enough capacity to pick up the UDAs that you'll be losing? If not, what is the recruitment like? Have you sort of put any feelers out in an attempt to see if there's any availability in terms of new associates joining the practice? But that's something that you really do need to consider. Obviously, if you want to keep just a few UDAs, perhaps reduce your commitment significantly, but keep enough to see the most vulnerable patients. So maybe that could be your children, it could be disabled patients, it could be your over 80s, it could be a core group of your patients where you feel in an ideal world you'd perhaps like to keep some UDAs, but obviously all of that would mean that you would have to negotiate with your ICB to see what their view is on that, how accommodating they can be with you. And all ICBs behave differently. There's not one size fits all. So it could be them telling you it's kind of an all or nothing contract. They might be sort of more flexible to allow you to reduce and just see those groups. But those are all conversations that you need to have firmly in place before you push the button again and a decision is made. The timeline and how you're going to do your conversion is something you also need to have in the back of your mind before you start. So in terms of timeline, if it's a whole practice converting and you are relinquishing your contract, then obviously you have to give 3 months, calendar months notice. So we have to build that in so that we've got time to send out the communications to your patients, to give them time to respond and work within that 3-month time frame for when the contract will end. Or it could be that you keep in the contract, in which case the timeline will depend on which method then you decide you want to carry out your conversion. And there's usually 2 ways of going about it if you're not relinquishing the contract. You can either still work within that 3-month notice period so it's over in quite a timely manner. So albeit you're keeping the contract, you've still got that deadline in place for patients to make a decision. Or you might want to take a slower approach where you're thinking, well, we're keeping the contract in the practice, therefore I'd like to have a little bit more time with this and make sure that I'm able to speak to all of my patients as they come in for their appointments. So you could perhaps do the one last appointment and then the patient makes a decision approach, which is probably more of a 12-month process than the 3 months with you giving the contract back. I do hope that some of these tips have helped you and give you some thought in terms of what do I need to know? Have I considered these options before I decide to go ahead? But these are all things that we can help you with and would go into an awful lot of detail with you to make sure that the decision is right for you. So if you do feel that you'd like more help or you'd like to get in touch with us, please do contact us and we'll be happy to give you some advice on this. Thank you for listening.